Time for New Wellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery. Time for New Wellness.
Evening. I want to thank you so much for tuning in and for another wonderful episode. David Getoff is no stranger to New Wellness Healthcare, and I'm so happy that he's here again today. We're going to be talking about something that's very serious, a situation really, I'll be sharing my situation that almost cost me my life. So we're going to talk about dentistry. What is holistic dentistry? Okay, so I'm going to open this up to my dear guests, and we're going to go through some good and bad things that happen in dentistry. Is mercury really why mercury should be removed and how it should be removed freely? We're going to be covering a lot of wonderful topics as it relates to your teeth. And some people tell me there's no relationship between your teeth and your organs. And we're going to be showing you some things and actually factual information to show you there is a relationship between your teeth and your organs. So my guest today is David Getoff. Thank you so much for being here again today.
My pleasure.
Yes. So I want you to tell everybody a little bit about yourself. Again.
Okay.
Yes.
My name is David Getoff, obviously. I'm a traditional naturopath and a board certified clinical nutritionist. I have a 28-year private practice in San Diego County. Most of my day is spent helping people improve their health from whatever condition they may bring into my office and don't want to continue to have. And I also wrote a book, Abundant Health in the Toxic World. I also lecture at dental and nutritional and agricultural and medical conferences around the United States. I also try to keep my website up to date, which you can get to at just davidgetoff.com. Hopefully you can spell both of those, David and Getoff. Although people very often say, David, your website's down. I go, what are you talking about? Well, I put in David Getoff and I didn't get there. I go, well, I'm going to assume that you spelled David correctly. So you must not know how to spell get off.
Get off.
Right. And for some reason, they add an extra T. They take off one of the F's. They put an H in the middle. They can't believe it's a name and it's just get off. But it is.
Yes, so, it is.
But yeah, that's basically that's me in a nutshell. Just helping people get well and producing videos and audios and my website and lecturing at conferences and mostly seeing patients in my office.
And that's how we met. We met at a conference, and then I purchased your DVDs to have in my office and let people watch them as they're getting their 2 or 3 hour IV trips that we do, our nutritional therapies that we do at our clinic. So I just want to thank you so much for being here. You know, and after people start watching those tapes, it really helps me a lot not to do so much talking because you have covered so much material that we can talk afterwards. So I just want to thank you for taking the time to produce the tapes that you have produced and done the lectures because they're very thorough, they're lengthy, and I tell a person, well, if you go to sleep, you know, while you're having your IV, I will put it on again for you next week when you come back again. So I don't want you to miss any of it.
Most people can't sleep while I'm talking because I'm not dull and boring.
No, you're not. No, he keeps you laughing. And as you will find out, watching the show today, you will stay not so much just entertained, but the education material is going to be very rewarding. So please get your pen and paper. Please, right now, share this show because the life you save may be one of your family members. Most important, it may be your own. I had a tragedy myself with a bad dentist. So we are going to tell you some things to look out for today. So this will never happen to you. I'm sure this story, pretty soon, you're going to see it on national television because I'm not very happy as to what happened to me and to myself and about 6 others that I know of. But right now, we're going to talk about what is holistic dentistry and what is the difference between going to a mainstream dentist, which, you know, I don't go to mainstream dentists anymore, and what's the difference between going to a holistic dentist.
Well, the biggest difference, you know, holistic doctor, holistic dentist, means that you're going to somebody who is using a great deal of training that they were not taught when they went through school.
Exactly.
So holistic dental training was not taught in dental school. Holistic medical training is not taught in medical school. So in dental school, they tell you, for example, that silver amalgam fillings, which finally, just a couple of years ago, are no longer the dominant filling. We finally got to the point that we can say that more than 50%, it might only be 51%, but more than 50% of the fillings that are placed in people's mouths today are not the silver amalgam ones. But that means, 45 or 48% still are. They're still teaching you that those are totally fine. They're not telling the dentists the facts that have been proven that they know about, that are even up on the ADA's website, that because it is simply an amalgam, it is not a new alloy, it's just an amalgam of a bunch of things mashed together. The mercury, which is 50 to 52%, is continually, from the very second that they make the filling,
You know what I'm going to
outgassing.
do? You know what I'm going to do?
Yeah.
Because what you're saying is so valuable and so important. I'm going to have you slow down a tad bit.
Sure.
Okay, just a
Happy
tad
to.
bit.
Yep.
Because people need to see those figures that you're saying. Because a lot of people, as you see, there's teeth there, and they don't know that people are still doing this. And it just happened to a well-known entertainer who went to a dentist, and he actually told her, "Do not put any filling, any metal filling in my mouth." And when he woke up, they were in his mouth.
Wow.
Can you believe
Lawsuit.
this?
No, yeah, but can I believe it? Sadly, I can believe it. But
I really didn't think people would do, after you tell them don't, you should know not to do this in the first place.
that's about as much malpractice as you can get.
I don't understand this.
I don't understand at all.
You
So
know-
yes, so still somewhere close to 50% of the fillings that are put in today in America
50%.
are called silver amalgam fillings. And they shouldn't be called silver amalgam fillings because more than 50% of them is mercury. And so why would you not call it a mercury amalgam filling? Well, they didn't want to use that term because mercury is a deadly poison.
Yes.
So they've never used that term, but that's what's in there. And all of your life, even if the filling is in your mouth for 50 or 60 years, and they know this because they pulled out 50-year-old fillings, and they're still outgassing or off-gassing mercury.
Yeah, and we want to show you a little videotape, now that you said outgassing, and let people see this outgassing mercury from the tooth.
Right. This is a tape that was done by the International Academy of Oral Medicine and Toxicology, the IAOMT.
Yes.
And they took a tooth and they photographed it with the type of lighting necessary to show the mercury vapor coming off it. And you go ahead and run that.
This way. Now, when this is happening, and you can see that vapor. Look at that vapor. That's a tooth. That's not a gun. Someone's putting some vapor through there. That is your tooth. Now, that's sad. Now, guess where this is going? The first place it's going is to your brain.
Yep.
The first place this vapor is going, this vapor metal is going to your brain.
And in case anybody says, well, wait a minute, I know a little bit about medicine, and I have a blood-brain barrier, and it's not getting past that. Sorry, mercury destroys the blood-brain barrier.
Oh, my goodness. I thought at one point it was illegal for them to put mercury.
No, the silver amalgam, well, at the very,
Silver
very
amalgam.
beginning, when they
Okay.
first came up with it, there was a rift between two groups. And one group said, how can you put mercury into anybody's mouth? This is a horrible thing. And the other group said there wasn't any problem with it. And that became the stronger group, which later changed to the American Dental Association. And so it was never made illegal. However, because of a bunch of lawsuits, there are now a number of countries where it is illegal. And there was actually a beautiful documentary done with a title something like Norwegian Dental Assistants, because the Norwegian dental assistants, with all sorts of neurological diseases caused by mercury, were suing the Norwegian government because it's a socialized medicine.
Right.
So the government allows this and does all this. And when I first was told about this by one of our top anti-mercury people, Dr. David Kennedy in San Diego, he sent me a copy of it to watch. And I said, can I put this out for people? He said, no, we can't let anybody know about it because it's still in the legal channels. Well, they won their lawsuit, so it is now allowed to be out there. And if you go to my YouTube channel, it says Norwegian Dental Assistants, and you can watch the entire documentary.
Okay, I would love to see that. So since we're talking about the 50%, 50-50,
Approximately, yeah.
what's supposed to be.
Yeah.
After this stays in the mouth for a long period of time, this metal has a tendency to expand and cause your teeth to crack. So a lot of people, I was out one night eating dinner, and I'm thinking I ate a piece of glass. And I'm thinking, no, it must have been something in the food. Until I really examined the piece, I'm thinking, well, this is many, many years because I had them removed. When you know better, you do better. So I had all the mercury amalgams moved, or the amalgams removed.
And we're going to teach you how to do that correctly so you don't hurt yourself.
Yes, but that will expand and cause your teeth to start cracking. And I let people know that because they said, oh, my teeth start breaking. I guess it's, I don't have enough calcium. That's the first thing they would tell me. And I said, well, do you have a filling there? And if you have a filling, they say, open your mouth. I'm not a dentist, but I'm going to refer you to someone. Then you need to have this removed. So now that we're up to maybe what the metal does in the mouth, other than it produces its vapor and it goes into the brain tissue and gets into other parts of the tissue as well. Plus, it is heavily found, at my understanding, through research, in the thyroid tissue.
It gets into the thyroid tissue, it gets into the liver, it gets into the kidneys, it gets into the gut, it gets into the brain.
Yes.
So there's certainly a very good belief that some of the Alzheimer's and dementia and other memory problems are caused by some of the mercury up there. One of the things that I find the most interesting about the use of silver amalgam material for dentistry is if you had something in a piece of wood, in a piece of granite, in a piece of glass, whatever, which was harmed, and you wanted to grind that out and seal it or put something over to make it look good, you would simply take out the bad part.
Yes.
And you would put in whatever this new material is. And that's what's done with every different type of filling material except silver amalgams. All the other materials that they use, some of which have other things that aren't good in them, plastic agents and hormone agents, but all they do is remove the bad part of the tooth and bond in whatever they're going to put in its place. That's not what has been done for all of these decades with silver amalgams, because silver amalgams do not get glued in place. Silver amalgams just get mashed in and pressed real hard, and if there was just a little piece taken out, it would fall back out again. So whenever they use silver amalgam material, the dentist has to use their device on their drill. It's called a dental burr. And in addition to taking out just the bad stuff, they then go further. They undercut in a bunch of different places, taking out a whole bunch of healthy tooth,
Oh my goodness.
so they can mash the amalgam in so that it spreads out and holds itself in place. So they very, very badly jeopardize the structural integrity of the tooth every time they use a silver amalgam instead of something else. So
This
there are
is
a
why
lot
the
of different reasons.
when the metal starts to expand, it's breaking off your tooth into smaller bits. Oh my goodness. This is really sad. And it's think when they used to do this to children. My understanding, they're still doing this to children as well.
Oh, yeah, they're still putting it in. Age is irrelevant. They're still putting it in. Whoever it is that dentist, if they're still using amalgams, which is many of them, they are still certainly putting it into kids. And what's interesting is that because mercury is liquid at room temperatures,
Yes.
everybody listening was probably has seen mercury.
In a
And they have
thermometer.
to, in a thermometer, and they have to put it into this amalgam with other different things in there, copper and silver, to make it into something that's semi-solid. But because the mercury itself is actually liquid at room temperature, it has what's called a high vapor pressure. And that means that anything that you do to increase the temperature of the silver filling will cause a great deal more mercury vapor to come out. So if you might do something like, I don't know, have some hot tea or hot coffee or hot soup, you greatly increase the amount of mercury that comes out. If you decide to chew your food, as you grind on it, you're increasing the amount of mercury coming out. So we're really putting something in which is, I believe it's classified as one of the 10 most toxic non-radioactive substances in the world, and we're putting it into your mouth. It can no longer be put in all sorts of other different places. When I was a kid, the switches to turn the light on, the ones that made no noise at all, those were mercury switches, because when you moved the switch up, the little blob of mercury went down, connected the two little pieces of metal, and then the current went through and the light went on. Well, that's now illegal because mercury is toxic.
Yes.
We had mercury thermometers. Those are illegal because if it breaks, mercury is toxic.
Yes.
If you
All the
open
poison control.
all the poison. If you raise the hood of your car, it used to have a mercury switch in it. When you raised the hood, the mercury would fall down and make a contact and the light would come on. Now they have to use a different type of sensor without mercury. So mercury has been outlawed almost everywhere because of how toxic it is, and yet they're still allowed to put it directly in your mouth to be vaporizing it into your brain and your body for the rest of your life.
I think, and for this dentist, the one that I know, for her to do this to patients, I think, as you say, it is a medical malpractice. And you will be seeing this more, not on my show, but on national television, from the people who are doing this, especially one particular person who is 2 people in the office where this is happening. Not far from my clinic in Marina Del Rey. So I just want to say, if you have had this happen to you, please call me, because we want to see what we can do to help other people. Now, I've been going to Tijuana for my dental workup since I was a victim of this poor dental service. And I want to say that everyone that went to her had major problems and needed surgery almost after her work. So I just want to say that let's talk about the type of scanning that a holistic dentist would do.
Okay.
Plus, the thing about it, she actually did that type of test. And I was so surprised at her findings, because she found out that the esophagus was narrowing, and polyps on the sinus cavity. But guess what? All 6 people that went to her, we all had the same diagnosis. Scary.
That's
scary.
slightly unlikely. So yeah, there's actually a doctor, Thomas Leetv, who wrote a book. It's got a picture of a scan of teeth on the front of the book. And I'm trying to remember the title of the book, Hidden Diseases, Hidden Killers, something like that, by Dr. Thomas Leetv. And what he's writing about in this book is that a particular type of scan, which can be called a dental CT or an ICAT cone beam, where they do a scan of your mouth. It's basically a CT scan of your mouth, where if the dentist uses this technology and does a good job and understands how to read it and look at it really, really carefully, can find infections sitting under and around root canal teeth, which we can cover root canals, or healthy teeth where there's an infection underneath it, or maybe you had some teeth pulled when you were a child because they wanted to move the teeth around with orthodontia, and they pulled the teeth, and now there's an infection there, and a regular x-ray will rarely find the infection. The hot and cold and mechanical and electrical test there will rarely find the infection, and this infection, the bacteria that are in there are busily living. When we go to the bathroom, we use the toilet. When they go to the bathroom, we are the toilet. And therefore, a lot of the toxins that come out of the bacteria in your mouth end up causing heart irregularities in one person, multiple sclerosis in another person. And what I find interesting, and I've never been to Germany, but I've had enough people tell me this that I have no reason to believe that it's not true, that if you go into a medical clinic in the United States, you're going to have medical doctors, osteopathic physicians, you might have a PT, you might have a nurse, you might have a dietitian. You will never, ever have a dentist in a medical clinic. And if you ask the doctor why, they'd look at you like you were an idiot and say, why are you even asking me that? This is a medical clinic, not a dental clinic. Whereas all of the cancer clinics in Mexico, not in Mexico, in Europe and in Germany, and all of the good clinics in Germany, all the holistic ones, not only do they have a dentist in there, but if somebody goes for treatment for cancer to any of the, let's say, the King's Clinic in Germany, the Paracelsus Clinic in Sweden, the first person they send you to is their dentist. Because if you have some silver fillings, if you have a couple of root canals, they won't start helping you to work with you to see if they can help you against your cancer until those are all removed and remedied, because they go, otherwise, the things that probably are part of the cause are still there.
Exactly.
Here, we don't even talk about it.
Yeah. And I tell people when they first walk into my office, when they have an appointment and they come in, and they fill out this very in-depth questionnaire, because, again, and they do a lot of testing, lab-wise, and not just looking at what we call the normal, we're trying to see on the optimum level where they are. where their blood tests come when we do the blood test. But also, ruling out, the fact of medications, because that's going to rob you of nutrition. But most important, everybody that comes to my office will get the CRT, the contact thermographic, the contact regulatory thermograph. This has been a long day for me, so please hang in there with me. Thank you so much. So this is the machine here. It goes over 119 acupuncture points. 119 acupuncture points. You see that little red probe? We're able to go over everything from the top of the head to your thyroid, your teeth. And when we do the teeth, we show the teeth organ relationship. So the teeth organ relationship, as you see there on the screen there, the teeth organ relationship will show you. Now, I know we both know, you knew him too. I had Dr. Huggins on my show several times. And he got to the point, he said, if you have one bad tooth, it's the entire body. But I like the tooth organ still charts. But when we go through and we find a bad tooth, I tell a person, I don't care what you come in with, or you could just say, I just want to see how healthy I am. We're going to do this test among several other tests, because I have the results of this immediately. By the time you're dressed, 5 minutes, I have the results. So it's a full printout report. So I can see your teeth, the organs. It's a Class 2 FDA approved medical device for breasts, for breasts, ruling out breast abnormal cells. So I like to do this because people can see, oh my goodness, I wondered why I had this one lady had pain in her left shoulder, and it had been there for a long time. No radiating pain, no trauma or anything, but she had several teeth hitting on that area. Now, a lot of people know my history and know that I had heart issues and been in, 2 comas. Well, I had 4 teeth hitting the heart. So after that was taken care of, a lot of my heart issues subsided after I did a cavitation, and I'm going to have you go through that a little more too. But after I had that done, I'm telling you, it was amazing. I felt so much better. But then I went to this bad dentist this year, 2019. bad dentist. To the point that by the time I went over to Mexico months later to get some of this corrected and had an EKG, in the interim of her and her work, I had a mild heart attack from the dental work. So I just want to say that, she started off wonderful. I thought her assessment was wonderful. Other people who watched the show thought it was wonderful. But the things that happened, and the sad thing about it is that she didn't want to correct the problem. It's
that's a problem.
She didn't want to take ownership and correct the problem.
Yep.
So I'm bringing out the show because, you don't know who she is, but the people who listen to the show who've been there, they know who she is. And you will be seeing her face again, because this was absolutely wrong for her to do this.
Yep. And two additional great books for people to read if they want to, in addition to the one by Thomas Leetv. One of them is called Uninformed Consent by Hal Huggins, because that's what he always said is happening when you get into the dental chair. Does somebody say, now we're going to be putting something in your mouth that's extremely toxic called mercury. Would you like us to do that? No, they simply fill your tooth without consent. Therefore,
and this person said, don't put anything, and did it anyway.
And they still did. So Uninformed Consent by Hal Huggins is a good one. Another great book is called Root Canal Cover-Up Exposed by Dr. George Meinig. He was one of the 16 founding members of the American Endodontic Association, so the people that do root canals. He was one of their founding members. And when he found out all the work that Weston Price had done, that found out that when you do a root canal, you can't really seal the tooth, and bacteria can set up housekeeping in there, and it can end up being the focal point of infections that nobody realizes are the reason you've got this neurological disease, you've got that heart disease. He said, oh my goodness, I have to write a book on that. And the book is Root Canal Cover-Up Exposed.
I have that book. And somebody borrowed it and never brought it back.
Well, George used to sit right next to me on the Price Pottinger Nutrition Board. He was on our board for many years until he passed.
It's a wonderful book.
Yeah.
Wonderful. So please, for those of you and your doctors say no, or you want to schedule yourself for a root canal, before you do that, please read this. And especially people who have debilitating diseases, cancer. I'm telling you, I've seen the link One lady had breast pain so bad she was at her dentist's office when he went in and finally did a cavitation, cleaned it all out, removed the root, the remaining root. The pain in her breast went away immediately. Immediately it went away.
Yeah, I've had people where somebody had a couple of root canals pulled, and they came back to me and they said, it was like somebody lifted a veil that had been over me for years and years and years.
Yes.
You know, nobody had realized until we took a look at that possibility. When you have root canals, it's one of my questions on my questionnaire. Do you have any root
Explain
canals?
to our guests, our listening audience, listening and the ones who are watching, explain to them what is a root canal.
Okay, very
Because
simple.
a lot of people don't understand they didn't take the whole root.
That's correct.
Yeah.
Right. So root canal means, or what happens is, the dentist believes, and they're often wrong because I've saved a lot of teeth that were supposed to need a root canal, but the dentist believes that that tooth is dying, and that as it's dying, if they don't do something about it, it might end up getting infected and causing a lot of problem.
Okay.
So what they do is they kill it on purpose. They go in there and they kill the entire root, and they drill into the entire root, and now it's dead. And then they fill that area with various materials. One is gutta percha, actually, which has mercury in it. But they fill that.
Gutta perch?
Gutta percha, yeah.
Okay.
Which they fill that up with. And they were taught in dental school that when you fill this up, it seals the tooth. And now they're going to put a crown or cap over that. And now you have a dead tooth connected to your jawbone, which, because it is dead, it has no circulatory system.
Mm-hmm.
So your immune system, no matter how good it may be, cannot get at any kind of infective agents, any pathogens that end up setting up housekeeping in there, because it's dead. And if you ask any other surgeon in any specialty, what do you think about leaving a piece of dead bone, because your tooth is bone, inside the body somewhere? Maybe you're doing surgery on somebody, and as you're going in there, you see a little sliver of bone from some accident that happened. And yeah, but it's not easy to get to. It's behind a tendon. What do you think about just leaving it there? The surgeon will go, are you kidding? Leaving a piece of dead bone in the body?
Exactly.
You never do that.
Exactly.
Because it's not connected to the circulatory system. That can end up getting infected and cause a focal infection. And we pay endodontists to purposely do that when they root canal a tooth. And you can't seal it, and Weston Price proved that a long time ago, and all of that information is in Root Canal Cover-Up Exposed, where you can read the actual facts.
Because several people say, well, I'm going for a root canal. I said, you don't want to do that. I tell them about the book, and they read it, but they still don't get it. And they said, my dentist said it's safe. And I said, well, you know, I tell people too, you can go into an elevator up onto the 20th floor, and you can jump. And as you're falling from the 19th floor, the 18th floor, the 17th floor, you can
say,
wave.
I'm okay so far?
You can say, I'm okay so far. You can say, I'm okay so far. So yes, your mouth is okay so far. A lot of people tell me my health is okay so far. But if you had these things done, you're falling.
If
And
people
soon you're gonna hit bottom.
realized, if people really realized how much of what is taught to dentists and what is taught to doctors is wrong, then maybe they would take these people off their pedestals and say, you know, they're human like I am, and if I can make mistakes, why is it that if you put DDS or MD or DO after somebody's name, all of a sudden they can't make mistakes? And the doctors I like the best are the ones that have said from the podium at a medical conference that when I went to medical school, one of the lecturers told us somewhere around 50% of what we're going to teach you is correct, and somewhere around 50% is wrong. We're not doing it on purpose. If we knew it was wrong, we wouldn't teach you. Don't ever stop learning. Then they forget it when they get their MD and come out of school.
Yes, yes. So now, when a person have had a root canal, what is the next step? Say they've had root canals, like myself, without me explaining what they did, which I did have the treatment done over in Mexico. So I want you to explain why it's important after you've had a root canal to take care of that tooth.
Well, the couple of most important things that you can do is at least every 5 years have the ICAT cone beam done. So if there is an infection that is starting to occur underneath or around that tooth, somebody can find it without it being there for decades and causing problems that no doctor will realize came from there. And then if they do see that, depending on how bad it is, where it is, and what your dentist's abilities are, they will either recommend that it gets pulled and that area gets properly cleaned out, and then you have to decide.
Now, when you say properly cleaned out, is there another name for that?
Well, some people call it cavitation surgery because they say that the infection is cavitation. Other people don't use the word and just say they're
Just
cleaning
clean
it
it
out.
Okay.
And the people that have ozone will also put ozone into that area. And then you have to decide, do you want an implant? And a good holistic dentist will use an implant with a post made out of zirconia instead of titanium.
Okay.
So all sorts
Let's
of
say that
different
again,
things you
because
can
I have
do.
two people that want to go do that now.
So right, if you're going to get an implant, from everything I've seen and read, you're better off if you make sure that your dentist that's going to do that, or the specialist that's going to do that, is using a zirconia implant. They usually come from Germany,
Okay.
rather than titanium. And then you have to decide what your tooth should be made of. My preference would be CEREC, CEREC. If, however, there's a possibility that you can get that infection killed without doing all this, that would be a good idea. Is there a possibility? There is. The only thing I know that has done that in some people is the use of dental ozone, where the ozone gets actually injected into the gum tissue, into the crevicular space, into the tissue itself, and the method that's used, that's taught by the American College of Integrative Medicine and Dentistry in Saddlebrook, New Jersey. And if your dentist is using ozone and he wasn't certified by them, I don't necessarily trust that he or she knows what they're doing. And the procedure, because I'm not a dentist and I took their seminar anyway. I wanted to learn what they're teaching. Now I teach nutrition for them for their naturopathic dental program.
Oh my goodness, how wonderful.
And
I've had it done. He was certified.
Okay.
The
and
ozone.
what they do is they treat the area once a week for 6 weeks and leave it alone for a while and take another look and see whether they've gotten rid of the infection. So sometimes ozone is a fantastic way of killing bacteria, viruses, fungi, pathogens. It's used in Germany a lot. There's a documentary that was made on ozone, all about using ozone. In the United States, it's legal, but it's not talked about and it's not taught in any of the schools.
Okay. Yeah, I've had it done. It was amazing. I thought it was going to be very painful. One of this particular doctor in Orange County, he said, "It's amazing. You sent me many patients. Said you're all doing great. Why haven't you come?" He said, "I know why, because you're scared." I said, "You got that right." But eventually I did go and have it done. And that was before, this is several years ago, before I met this dentist. And I only went to her because she was in the same building where I am. And I made it very easy because I had a little toothache. And I'm like, let me just tell her to pull this tooth. I don't have time to go all the way to Orange County. But we have to take out time for ourselves. So I had taken the next step and went back to him. I wouldn't have this problem I'm having now.
There were actually 2 documentaries done on ozone, and if I remember their titles correctly, so you can search for them, they are Ozone Medical Miracle and Ozone and the Politics of Medicine.
Okay.
And if you can find either of those DVDs, buy it, watch it, you will be astounded, absolutely astounded.
Well, thank you for sharing that with our audience too, because that's what the show is all about, is to make sure you obtain the information, share it with your family, because did somebody write "Death Begins in the Mouth"?
I don't know. I remember Death Begins in the Colon.
No, I remember. I think that was the name of our show.
Okay.
And I was the victim. I didn't die, thank God.
Good.
But that mild heart attack was not fun. But I'm telling you, the teeth, the gums is your first line. So definitely when you're seeing someone, a practitioner, make sure they understand this part of your healing, your treatment.
Yeah, and
your
if you're
your overall initial workup.
Right, and if
'Cause
you're
they
going
don't
to a
know that.
dentist to, if you decided after listening to us, after reading some of these books and whatever, that maybe I want this mercury out of my mouth.
Yes.
You have to go to a dentist that has been properly trained and does everything correctly. And you can go to the IAOMT.org and you can look at their dentists. You can go to DAMS, which is the Dental Amalgam Mercury Syndrome. You can go to the Holistic Dental Association and find some people that have gone through their programs and that are approved by them. And
I like the first one.
IAOMT is a fantastic organization.
So please just put that up so people can see that. and find you a dentist who's been trained.
Yep.
We don't have many in California. They are very, very expensive.
And well worth it. And it's
Yeah.
really interesting because different dentists will do different things, and some of them are super important, some of them are less important. The most important thing, if you decide to get your silver mercury amalgam filling slowly removed, is to make sure that the dentist was properly trained. And number one, that means that his or her assistant is standing right next to them, not to do what they want, not to reposition that thing that's grabbing your saliva. No, they're holding a high pressure vacuum
Yes.
right next to where the dentist is drilling, so that all of the mercury vapor, instead of going into the room for the dentist to breathe, for the assistant to breathe, and for you to breathe, they're being sucked into the vacuum, going into a special unit,
Exactly.
and then they have to dispose of that unit's filter as a hazardous waste because of the mercury vapor that's been in it.
Ask questions.
So ask questions. That number one is high pressure vacuum right next to it. Number two is they usually use what's called a dam, which gets put in.
Rubber dam.
Rubber dam. The teeth they're working on are popped through the dam. That way, if as they're drilling, a big piece of amalgam filling comes out, instead of you swallowing it, it gets caught.
Yeah, the rubber dam is like, well, to me, I'm a female, diaphragm.
You are. I agree.
It kind of reminds me of a diaphragm,
Okay. Yeah.
you know, because it's round and it sits in the back of the mouth, again, so you don't swallow.
Right. It's just so you won't swallow anything.
So are they making them any different than that now? I don't.
Now it's just a piece of rubber, which they can stretch over different size frames.
Okay.
And make a tiny hole that tooth pops through. And those are the most important. I mean, if that's being done, everything's fine. One dentist puts their patients on oxygen. Another puts their patient on filtered air. Somebody else has them on IV vitamin C. That's fine. I have no problem with
Yeah,
that.
I've had all of that in the
But
past.
none of it is as important as that high pressure vacuum.
Yes.
Because if it's pulling everything out, I don't care about all the other stuff. But if somebody's really, really, really sick, they might need to have somebody good, your clinic, me, a bunch of other people, whatever, to improve their health a little bit
Before.
all that stuff is
Yes,
done, because that
yes.
might be the amount. I mean, it is technically surgery. You're
It
giving
is.
an anesthetic, you're hitting the nerve, and we don't want to make people go downhill.
Exactly. Yeah, well, I know after I had the surgery done over in Tijuana, I felt so great because they said, well, we're going to put you in a wheelchair and take you upstairs. And when they finished, I said, oh, no, I feel great. I don't need a wheelchair. Yeah, I felt so great. I really felt wonderful. So it was a great experience, except now I just had to follow up.
I had 26 visible silver fillings. And
26?
And the rest of the 32 were underneath 3 crowns, because they often crown right on top of the silver amalgam mercury fillings, which are still going into your mouth. They're not vaporizing this way. They're now going instead
Straight into
through
the body.
through the tooth.
Yeah.
And that's what I had when they redid everything in my mouth about 20 years ago.
Oh, my goodness.
Because I believe in prevention.
Yeah.
I am Mr. Prevention. And if taking something out may make it so that, now I'm 67, and I would like, when I'm 77, 87, 97, hopefully 107 and 117 if I can get there.
Yes,
I would
yes.
like to still have the memory I've got now at 67,
Yes.
which is perfect.
Yes.
And therefore, anything I know that's horrible for me, the stuff we've done on previous shows on EMFs, I
Yes.
try to avoid the things that there's research that's hurting me, because I like prevention.
Yes. And this is what you not only do for yourself, but this is why you are who you are and how you work with your patients.
That's true.
And you can tell people who really love themselves that they look healthy. It's a horrible situation to go to. And we go to a lot of expos, but seminars and things. And you see people standing behind the tables and they look so unhealthy. It's like, really?
Why would you go to that person?
You really
Yeah.
would go to this person and they look unhealthy?
Mm-hmm.
I would be, I don't, even if I have a cough, which I did, but I needed water, I don't go and I don't see patients. I don't think anyone's feeling bad, feeling sick, under the weather. You should just stay home that day yourself.
Sure, but people don't.
They don't. And then you go and you transfer all these germs to them. But if a person is sick and they know they're not well, they should not be there taking care of a patient.
Yeah, if somebody
They
is
should
sick,
not.
they should not. But dentist, doctor, anybody that's dealing with the public, they should not be. They should call in sick that day.
Right. What is some of the common problems with periodontal disease?
Irregular heartbeat. A lot of stuff having to do with the heart. Atrial fib can be caused, from your mouth. And of course, periodontal disease means basically that you have infection in your mouth.
Right.
And the infection in your mouth can go to all sorts of other different places in your body. And people don't understand that.
Right.
I tell people the first thing that you want to do is find a toothpaste that doesn't have any poisons in them. Deadly poisons like fluoride should not be in there.
Yes.
And it shouldn't have all the other chemicals like sodium lauryl sulfate and everything there.
We got a great picture to show on the tooth and the heart. Yes.
Some of the toothpaste that I like that are simple that you can get in the health food store. NOW makes Xylowhite. It's not a super fantastic, unbelievable, but it doesn't have any poisons in it. That's really, really good.
Right.
Weleda is another one. Doesn't have any poisons in it. Spry doesn't have any poisons in it. I happen to like Perio paste, which is almost a prescription one because it's sold by dentists, but it's the one that I carry because it has a lot of essential oils and herbs that kill bacteria. And then if you use a dental irrigator, either a Hydrofloss, which is one of the dental brands, or a water pick, which you can buy anywhere, whether you're using a little bit of hydrogen peroxide, baking soda, or PerioScript, which is made for that, you're using that and it's going, and it's getting all of the stuff which your toothpaste and your dental
and
floss.
your flossing is not going to get.
People don't understand. If this is a tooth, okay, this
Your
is
hand.
the front of the tooth, this is the back of the tooth. Here's the next tooth. Where's your dental floss going? In here and in here. What's the largest area? Over here and over here. So how do you get that part? How do you get in underneath the gum into what's called the crevicular space? You can't.
Right.
But yes, you can with any oral irrigator, such as a water pick.
Water pick,
and
exactly.
And don't have it up on high. We're not trying to hurt the gums. Medium is plenty. We're just trying to gently wash out any little pieces of food that'll otherwise be there feeding bacteria you don't want for hours and hours or days and days.
Right, exactly. So this is why I understand, too, through some research, people who had plaque on their teeth and it was dark was associated with Alzheimer, the darkness in the plaque.
I never associate a color of plaque with something because we have too many dyes in our food. So if somebody drinks a lot of tea or something else that can change the color, we don't know what else might have changed the color. That's all.
The color of it, yeah. Because they showed it kind of being brown looking, not so much black, but brown. Okay, that was, I think, a study that was done over at one of the major universities. But again, I guess they saw the same color in the person's brain.
Sure. Okay. Yep. Well, our brains have a lot of problems because of what we eat and what we're exposed to.
Exactly. No, the question I had asked, but thank you for answering it the way you did, is what are the causes?
The cause of plaque.
Of periodontal disease.
The causes of periodontal disease, and Weston Price proved this beautifully, are three. Your diet, and your diet. And what he did was he traveled around the world in the 1930s, visiting tribal populations in many countries, and wrote a fantastic book on it called Nutrition and Physical Degeneration that the Price Pottinger Foundation keeps on publishing in Lemon Grove, California. And what he found was that all of these people had perfect teeth and no periodontal disease and didn't have any cavities into old age. And it was amazing. And he said, wow, these people are in fantastic health. They're strong. They could go out there and hunt something and carry it back over their back. Let's see what they're eating. And he studied all their diets. And they weren't eating any processed food because it didn't exist. They didn't even have electricity. Where are you going to go to the store and get processed food?
Right.
So they were all eating what their tribal people had been eating for thousands of years, different in different parts of the world, because different fish are around, different animals are around, different vegetables are around, etc. But none of it was processed, none of it was hybridized, none of it was genetically modified, none of it was sprayed with any type of chemical that they didn't even know existed.
Exactly.
And so they were in great health, and their body was easily able to keep everything working correctly. And what most of our periodontal disease and diabetes and heart disease and cancer all have as one of their basic causes are what I refer to as sabotage foods. Government gave me a trademark on that. Starches, sugars, and alcohols.
Yes.
Because what happens is the amount of starch and sugar and we'll add in alcohol in there, that we consume during the course of a year is thousands of percent more than your body can handle. And so the immune system goes down, and we're feeding the body with the food that the bacteria that we don't want to live there love.
Exactly.
And so that's a big problem. My cats are 9th generation raw meat. The only time they get to see my veterinarian is when he and his wife come over for dinner. And they were over for dinner a couple days ago. And the cats jump up on the table, and he grabs them and feels them up. Everything feels great. And he throws their gums up to take a look at their teeth. And he looks at me and he shakes his head and he said, "It's always amazing, ever since I learned this from you many years ago, that when you have cats and dogs that are eating a perfect raw meat diet and chewing on raw chicken necks to help break, plaque off the bones," he said, "their teeth don't need to be cleaned. And they're 15 years old."
Oh,
and
my
goodness.
goodness.
Most cats need a tooth cleaning.
Yes,
we
they
come
do.
in with their ultrasonic by the time they're under 1 year old. So it's all diet.
Diet.
Yep.
Yeah, and that's important. And so we're about to run out of time, but I want to make sure that we have covered everything. You have been so generous to take several trips from a long drive to be a guest in the studio, and I am so honored that you have taken the time to do this. So I just want to say, in closing, what would be some things you would want to share with the clients that as a take home, as a thought like aha moment, that I want to make sure that I keep that in the back of my mind when I think of my teeth?
Well, the most important
teeth.
thing for you to do to support your teeth, and I'm not the only one with this information. I mean, there are other people, but I don't know what theirs are, so I can give you mine, would be to go to my website at davidgetoff.com. And on the right side, something says additional resources. There's a drop-down menu. And click on the Healthy Diet Challenge. Print out those 2 pages. And at a point at which you're willing to do this, so like right now we have holidays coming up, and some people are saying, "I'm not going to not eat this, and this during the holidays." That's fine. I won't eat them. I eat the same all year round.
Yeah.
But at the time at which you look at that, you're willing to say, "Okay, for 60 days, I'm going to eat David Getoff's way." Do that and see what differences you feel in your health. And when you feel more energy and more level and not being hungry throughout the day, and when you get better sleep and all sorts of things, you might go, I think he said he had a course. Yeah, I've got a 10-week course that you can also get to through my website, the big green banner that says Nutrition Education Association. But the most important thing is you need to understand that what your doctor was taught about diet, what his nurse or her nurse was taught about diet, and what registered dietitians are taught about diet has been proven wrong for a long time.
Oh, yes.
And they're still
Yes.
talking about it. And I even have an audio on my site, why a dietitian should not be called a nutritionist, and you can listen to that if you want to.
Exactly. This is why my daughter, who have her master's in nutrition, took a different approach to it. At first, she was going to go for a dietitian, and she said, "Mom, no, it isn't what they're teaching." So I'm very happy. I have 3 daughters, and I know I seemingly talk about one so much, but because we work closer
Are you
together.
slighting your other 2 daughters?
No,
Okay.
no. My oldest daughter is phenomenal. She's the one that gave me my bestseller book title, and she's just a loving daughter. And my middle daughter is an administrator at a nice hospital. So, I told her, I said, it's going to come a time that you're going to want to do what I'm doing, or do your own. And that's exactly what she's about to do, something she's totally developed that's phenomenal.
Fantastic.
So I'm really proud of her. So you have been wonderful. So again, and we're talking about dentists and dental and holistic dentistry. Please ask questions. So what would be maybe the top 3 questions? Because we're just about out of time. Say the top 3. We have 2 minutes.
To ask a dentist?
Yes. Because you need to interview a dentist before.
Sure.
You read about them, but it's great to see what you have read on there. But when you walk in there, you need to go in there and
Okay,
look.
question number 1.
Okay.
If somebody wants a silver amalgam filling because they're trying to save money, will you put one in? If they say yes, hang up the phone and run to somebody else.
Okay.
Because the dentists that know what they're doing haven't used silver amalgam fillings for years.
Okay.
Question number 2, do you have an ICAT and do you know how to use it? Question number 3, are you familiar with biocompatibility dental testing?
Yes.
There are 2 labs, Scientific Consulting and Clifford Labs, where you can send a blood sample in and they look at how your blood reacts to hundreds of different things in dentistry, and the report comes back to the dentist and they get to see what they should and better not use in your mouth.
Yes.
And if they say biocompatibility dental test, no, I'm not familiar with that, hang up and find somebody else. You want somebody that says, oh yes, absolutely. No, I'm very familiar with it and I've got the kits here if you want. Those would be the first 3 questions.
Okay. Oh, I love it. I love it. I'm so glad I asked you that. But I also want to say, too, I enjoyed, not so much enjoyed, but after I had the surgery, they did the PRP. So the PRP is then you don't have to use a cadabra, as far as a bone graft in your mouth. So this was actually a wonderful therapy. But ask questions, look around. If you notice any strange smells outside of something that smell something you're supposed to use in a dental office, I would also run too, and look how happy the people are sitting in the waiting room, because that is a clue.
Ask how long they've been working for him. My dentist has the same people working for him for 25 years. They love him to death. You don't find that very often.
No. And it's funny you said that, because this person that we were talking about earlier has a turnover all the time.
Mm-hmm.
Yeah, turnover all the time. So I just want to say thank you. Thank you for sharing this. Thank you for listening. Thank you for watching our YouTube channel. Thank you for watching us live here on Facebook. And again, we have many other outlets. So we're going to conclude this wonderful show. And please share. And as I always conclude my show, because it's so important to know the power you have within. And the power you have within on I am, and being grateful. So repeat after me. I am so grateful that I am a magnet for miracles. And if you're looking for a good dentist, say these couple things first. Be positive. Know that you're going to go out and search for the best. Ask those 3 questions, very important. And make sure it's free to give someone a smile. The smile with perfect teeth, okay?
You can improve your magnetism for miracles with a better diet. They
Yes.
will come to you if you're eating better.
Yes, indeed. Thank you for that one. You're the first person who added to it. Thank you. Everyone, until next week, have a wonderful, blessed day.
Join us every Wednesday live at 11 a.m. for NuWellness TV with Dr. Lee. Remember, healthy mind, healthy body.